Hello, I am Dr. Namrata Agrawal, a critical care specialist at Borivali Healthcare. Today we will be discussing about golden hour inside an ICU. So you may have heard doctors saying that patient has missed the golden hour when they had come or are in the golden hour of their illness. So what does that mean? We will break it down. So golden hour is a 60 or 90 minute timeline when they arrive inside the hospital to take actions and to stabilize them immediately. This is the time when we do the rapid recognition and start the treatment, which can make all the difference between life and death. So why does this matters inside an ICU? So whenever patient falls sick, like in case of stroke, patient has gotten paralysis, or a patient with heart attack who has got chest pain and the blood supply to the heart has been stopped. Similarly, in case of stroke, where there is a clot in the brain and the blood supply to the brain has been stopped. That means the oxygen to the organ is not going in as the demand of the organ is, and that is why the tissue starts to die. So as the time goes by, more and more damage is happening to the tissues, and the damage to the tissue will not be reversible. So this irreversible damage is what we need to prevent in this golden hour by rapid stabilization and recognition, and to prevent the quality and quantity of life. So what we do in this golden hour, we stabilize the patient, we stabilize the circulation, heart rate, blood pressure, oxygen. We put the patient on ventilator if at all required. Also, if the patient has stroke or an heart attack, we shift the patient to cath lab and perform the angioplasty in the brain or in the heart, both immediately. If the patient has come in sepsis, that is infection, then we start the antibiotics immediately to prevent further worsening of an infection. Also, the patient has come with trauma. Most life-saving thing that we do is control the bleeding and give the blood transfusion to stabilize the patient immediately. We take steps to prevent further worsening of the same organ and to prevent body going into multi-organ failure. So we have faced many challenges because the patient generally are unaware that they need to come in this time period. They may not be accessible to larger hospital. They may get them to the smaller hospital where all the facilities are not available, and the patient may be asked to shift to a bigger hospital. So these challenges may be faced by you or by us also. So what we need is, don't wait. If you think that patient is unwell, if you see even any one of the warning signs, then please get the patient to hospital immediately. Wherever you live, always make a list of hospitals that are nearby you where all the facilities are available. So in case of emergency, you can always take the patient to that hospital. And always keep some numbers handy, like an ambulance number, like a hospital number, so that you can contact them in case of emergency immediately. So once you arrive in this golden hour, the quality of life, the complication rate and the quantity of life all can be improved, and the patient's life can be saved, and the length of hospital stay can also be reduced. So please remember, this golden hour is very important. It is not only for influencers, it is also for IC people as well. Thank you.